Hi, this is Dr. Jonas Leibowitz, an endocrinologist with 30 years experience, here to talk about issues with the accuracy of a hemoglobin A1C. Imagine you do a hemoglobin A1C for a patient and it comes back higher than you think it should have come back, or maybe it comes back lower than you think it should have come back. And these are not the issues that we're talking about with variations of the hemoglobin and the blood cells of the body. Now we're talking about patient-centered issues. So one example I can give you is a patient checks their sugar every morning and their sugar in the morning is 100. Sounds great. And they think they have a great A1C. And then you get an A1C test and it comes back perhaps 9%, which says that their sugar is actually averaging much more than 100. And 9% average is going to be about 210. So how do they get there from a sugar that's 100 every morning? Well, that patient may be finding that after each meal, the sugar rises quite high. Perhaps they just need to be on a medicine that lowers their sugar when they eat, or perhaps they eat more sugary type foods during the course of the day and their sugar rise is much higher than they expect. So that patient is surprised by the hemoglobin A1C being too high. Other patients, maybe you're surprised by the hemoglobin A1C being too low. Maybe you have a patient who during the day has sugars of 150 or so, or 200, and that A1C may be somewhere between 7 and 9% perhaps. And you're saying, wow, they get an A1C that's coming down less than that. Where did that come from? How did that happen? Well, patients, especially insulin users, may find that there are low sugars happening in the overnight window of time. Maybe from midnight to 7 a.m., a patient who injects insulin may have a low sugar, not know they're having a low sugar for various reasons, and then the hemoglobin A1C may not match. One test we have to learn about this and help sort it out is something called fructosamine. And fructosamine is another protein that's a byproduct or a breakdown product that has sugar that sticks to it. And it has its own levels of normal. It's usually measured in a range of the 200s to 300s. And there are some charts that correlate what a fructosamine may correlate to an A1C. The only catch is fructosamine is a 2 to 3 week average. So it's not giving you a 90-day average, but I'll use that sometimes to get an idea of where the patients are, because for whatever reason, I don't trust that the A1C is giving me an accurate measure, or sometimes I just want to find out if it is. Alternatively, if I want to check if I think the A1C is accurate, we can go back to going over sugar results. A 7-point glucose check where a patient checks their sugar before and after each meal and at bedtime, giving you 7 individual sugar results and averaging that together, and then correlating that with the A1C, or using the sugar results that a patient may get when they wear a sensor device in their arm to check their sugar throughout the day may also help you correlate if you think the A1C is accurate.